The background is quite simple. In fact, a few years ago, we established lenalidomide and low-dose dexamethasone as a standard of care for newly diagnosed transplant-ineligible patients with myeloma. So this was achieved in the context of the study called FIRST, which was part of ASH 2013 plenary session, in fact. And so lenalidomide and low-dose dex is a true standard of care, approved and established in many, many countries. So, and then we tried to build on lenalidomide and dexamethasone. And one of the most attractive drugs a few years ago was daratumumab. And we decided to do a large phase 3 study having lenalidomide dexamethasone versus daratumumab lenalidomide dexamethasone in elderly newly diagnosed patients with myeloma. So that, in fact, that's very simple in terms of design. That's very straightforward, I would say. So the study was very attractive. So the study enrolled a little bit more than 700 patients in 14 countries, US, Canada, many European countries, Israel and Australia. So the study enrolled patients between 2015 and 2017, and at this meeting we report the first analysis of the study, which is called the MAIA study. And primary endpoint is PFS, as usual. As you know, this is the usual primary endpoint in myeloma studies. So the study met its primary endpoint of PFS. So the control arm did very well. The control arm had a median PFS of approximately 32 months, which was somewhat longer as compared to what we had in the first study in the past. We had only, I would say, 26 months. And, but the study met its primary endpoint. The hazard ratio is 0.56. So the median PFS has not been reached for daratumumab, lenalidomide, and dexamethasone, and is expected to be at least 50 months, I would say. So this is a great achievement in terms of PFS. Of course, the survival is not mature. If you look at response, complete response rate, VGPR, or overall response, we achieved great results as well. 93% of patients achieved response, so almost everybody got response. 48% of patients achieved complete response, and 79% of patients achieved at least very good partial response. So we have, at the present time, we have 24% of patients MRD negative at 10-5. But in fact, we had a very rigorous assessment of MRD. So we assessed MRD only in patients in CR. So what we have is an underestimation of MRD negativity, I would say. And this will increase over time. So we may expect getting 30% or more MRD negative patients at the end. Looking at safety, the study looks good. In fact, the safety profile is very, very concordant with what we had noted in the past in other daratumumab studies, especially in combination with either lenalidomide or bortezomib. So as you know, we have daratumumab, lenalidomide, dexamethasone in the relapse setting, when we have daratumumab in combination with bortezomib, melphalan, and prednisone in the frontline setting. And basically, when you look at safety, it is totally as expected. We got a little bit more neutropenia with DRD, very few thrombocytopenia. Looking at non-hematologic adverse events, nothing very different, except maybe the fact that we had a little bit more pneumonia in the daratumumab arm. This was also observed last year when the daratumumab VMP study was reported. It's not concerning. It's a small increase, but we may have to work on this. And if you look at infusion reactions, that's approximately 40% of patients, but only 3% of patients at grade 3 or more. So that's very minimal, and again, this is as expected, I would say. This is a lenalidomide study, so as you know, in the past we got some kind of issue with second primary malignancies in some lenalidomide studies, so we looked at SPM. When looking at invasive SPM in general, having solid tumors and hematologic SPM, it's only 3-4% of patients, so it's very reassuring. So the median follow-up is not huge, but there is no signal. And if you look at hematologic SPM, that's 0.5% of patients in each arm, so that's very minimal. So there is no SPM discussion at this median follow-up. So the study looks great, and this will for sure establish this daratumumab Lendex regimen as a new standard of care for the elderly patients with newly diagnosed myeloma.